An episode of This One Time in Kankakee from the WVLI Podcast Network will start right after this. Support for This One Time in Kankakee comes from the Kankakee Area YMCA. The Kankakee Area YMCA is more than just a gym. It's a movement of thousands of people making positive changes in their lives and their community. The YMCA is Kankakee's premier provider of family health and wellness. Become a Y member today at their location on Kennedy Drive in Kankakee or at k3ymca.org. For youth development, for healthy living, for social responsibility. The Kankakee Area YMCA. Support for This One Time in Kankakee comes from Raven Spring Media, where method, media, and mindfulness create impact. From video production, photography, animation, and team building, Raven Spring Media creates compelling content that captures your brand's unique story in a strategic way. With over 20 years of visual storytelling experience, Raven Spring Media brings together creative expertise and a fresh perspective to every project they undertake. Begin your story today at ravenspringmedia.com.
This one time in Kankakee, I was on national news to discuss the autopsy findings of Mr. George Floyd.
We cannot attribute a medical condition that many people have walking around every day and then have that be the sole cause of death in this case.
Welcome to This One Time in Kankakee on the WVLI Podcast Network. I'm Jake Lamore. That voice belongs to Dr. Kalisha Hill. In Kankakee, we know her as the Chief Medical Officer at St. Mary's Hospital. But in 2020, she became a voice of clinical clarity during a moment when the rest of the world was shouting. Today, we aren't just talking about a viral TV moment. We're talking about the life of a doctor's doctor, a pathologist who looks past the noise to find the truth written in the human body. Dr. Hill grew up on the south side of Chicago in the Auburn Gresham neighborhood. She describes her childhood as blessed. A time of school fundraisers and neighbors who actually knew each other's names. But her most foundational memories happened on a back porch.
My Nana, who I spent a lot of time with when I was younger, the times that I would ask her questions about schoolwork and she would say, go look it up. She had a whole encyclopedia on the back porch and I would have to go look things up for myself. And also on the kitchen floor, we used to play concentration. And you would just flip the cards over and try to match them. And to me, I attribute that as my first exposure to critical thinking. And it's very important to realize that retention and focus and attention to detail are critical in anything you do, but it is fundamental to medicine.
Medicine was the family business. Her mother was a nurse, her father a physician. But it was her grandmother who gave her the first glimpse into the world she would eventually lead.
My grandmother, my dad's mom, decided when she was 42 to switch from a humanities professor to be a chiropractor. And she would take me to her classes with her. And so that was my real first exposure to surgical pathology. And I didn't know what it was at 10 years old.
For a long time, pathologists were seen as the doctors in the basement, the ones who only dealt with the deceased. But Dr. Hill came into the field just as that was changing. She realized that the pathologist is often the most powerful person in the room because they hold the diagnosis.
It was the exposure of the pathologist really having so much expertise that the surgeons relied on. And I talk about that in my book because that was really, to me, the pivotal moment when I realized just how powerful pathology is. And so to see a big burly surgeon hovering over a little petite pathologist and being mesmerized and hanging on her every word as she's analyzing the specimen he brought really did demonstrate to me, like, wow, I think this is something that I should consider. And then it literally just took 3 weeks at Northwestern doing an elective to say, no, this is totally my life, and fell in love with it, and it's been no looking back since.
She eventually found her home at St. Mary's in Kankakee. She fell in love with the warmth of the staff, but she also brought an academic rigor to the community hospital.
I don't feel that someone in Kankakee should have to drive to University of Chicago or Northwestern to get their initial biopsy, when they can come to St. Mary's if they feel something, or if their doctor examines them and finds something, that they can come get a radiology test, get a biopsy, and have the expertise and diagnoses that will guide their treatment, see an oncologist, see a radiation oncologist, and then get in a second opinion if necessary. Take all of that information, go to Northwestern, go to USC, and I can tell you that I'm very proud of the concordance rate that we have at St. Mary's, both for radiology and for pathology. So every time my reports go for someone to review them, they come back full agreement.
You might wonder how a doctor in Kankakee ends up on a global news stage. It wasn't a fluke. By the time 2020 reached its boiling point, Dr. Hill had already been in the trenches as a spokesperson for her field during the pandemic.
So fortunately, by the time I received the call related to Mr. George Floyd, I had a slew of interviews behind me. This was in the middle of the pandemic, and this was the time that pathologists really were in the public eye. Pathologists had to bring on the first COVID test. We literally created them. One of my colleagues, long time, brought up the first test in Illinois, and I got to interview her for the Illinois Society of Pathologists. And every pathologist was really involved and engaged in making sure the testing was accurate, and so that all of the treating physicians and the hospitals could triage patients appropriately. So I was used to people calling me by then to do interviews, whether they were newspaper interviews or radio interviews.
She had become a trusted source. But the call from CNN was a different beast. It was a tragedy that was tearing the social fabric of the country apart. She had almost no time to prepare.
The call from CNN was completely unexpected. And I did not have time to think about it. And I look back on that video clip from that interview, and I remember that suit jacket was the one I put in my office for emergency interviews, because I normally wear a lab coat every day. And so that was one day I got a call. I had maybe 2 hours to get ready, and so I had to grab the lab coat on. I had by then started carrying an emergency makeup kit with me and got it all done and did the interview there in my office.
No professional studio, no hair and makeup team. Just Dr. Hill in her office at St. Mary's, an emergency blazer, and a laptop. She was balancing the immense weight of the national conversation with the literal physical constraints of her workplace.
I did not think in the moment at all like, oh, wow, I'm going to be on CNN. And even when I did that artificial intelligence interview for Fox News, I didn't feel like, oh, wow, I'm on Fox News. All I feel is, oh, I get to actually share and teach and educate. Like, that's where the excitement is. It's not in my nature and in most physicians' nature to seek limelight just for the sake of limelight. And actually, it's kind of the counter, because we prefer that one-on-one patient impact.
Dr. Hill had to block out the protests and the civil unrest to focus on the clinical data. She explains a specific detail that clarified the cause of death for a confused public.
So the only thing I felt at the time was missing was that the understanding of what the cricoid cartilage and trachea actually does. And because I believe they released the autopsy report, it was made public, but I wasn't sure that people really understood that basically compressing that and cracking that cartilage, it's virtually impossible to breathe. And I think that's what makes the difference, because sometimes you can talk about, people get a chokehold, but they may pass out. And it doesn't necessarily mean that their cartilage is damaged. But once that's damaged, it's very difficult to recover from that without surgery. And there was no time after he had passed away to have that kind of intervention.
But even as she prepared to go on the air with these cold, hard facts, she saw a moment of profound empathy right in her own hospital.
Also during that time, that's when I found out just what a collegial and collaborative medical staff we had. So our medical staff has always had diverse political views. And at the end of the day, everyone converges on what's good for the patient. So it's not even pertinent in most circumstances. So when the president of the medical staff agreed to kneel with all the physicians and have that moment of silence for George Floyd, and this was before the interview, that's when I realized, okay, people just care about people not being harmed. And our physicians care about people not being harmed and also getting the medical care that they need. Doesn't matter who they are, doesn't matter what they believe. It's another human. They need health care. That's what we do. No questions asked.
For Dr. Hill, the responsibility of a physician is to see past the noise. She believes that medicine provides a unique lens through which we can bridge the deep chasms in our society.
We have an entire historical society that has set norms and biases towards many groups of people, and it had become pervasive. And I think we're at a point in time where people are starting to recognize their own biases. We all have them, myself included. And we have to recognize them and realize that every person, no matter who they are, has to be judged by their character. I really believe that, because I have known people that have had labels on them that they're supposed to be a certain way, and I've seen them do actions that are complete opposite. And then you may view someone one way, and then they surprise you with just how caring and loving they are. So you don't judge people by labels. You don't judge people by demographics. You don't judge them by their appearance, because there are some homeless people who are more giving than people who have wealth and are stingy. So you can't judge by anything but character.
Dr. Hill explores these themes, leadership, identity, and the weight of being the doctor's doctor in her memoir entitled Pinnacles. For her, the pinnacle is finding the common ground where education can actually happen.
I view the entire pandemic as an opportunity to make sure that we do things better in the future. There was so much misinformation and so much polarity that to this day, I feel that it was a missed opportunity. When George Floyd passed away, there was a moment that everyone in the country felt, okay, that should not have gone that way. And rather than everyone coming together to work on a future state where there could be consistent dialogue and change, there was this polarization that started to occur where everyone ran to their corners and pointed fingers. And we're still kind of in that moment. So I am prayerful that we, at every opportunity, find a way to bridge so that the next pandemic that occurs, we're not repeating the same mistakes.
At the end of the day, Dr. Hill is proud to work here in Kankakee. She stayed here because she believes in this community.
I feel like I've grown as a mom and a wife here because my children were doing volunteer work at St. Mary's in high school and put those hours on their college application, and all of the staff and doctors were so welcoming to them, to which one of them is now in medical school. And to know that this small community can lift people so far is really tremendous, and the people here deserve that recognition, and St. Mary's deserves that recognition.
Dr. Hill reminds us that whether it's an autopsy report or a neighborhood conversation, the truth is found in the details, and the top line is always humanity. This One Time in Kankakee is produced by me, Jake Lamore, and the WVLI Podcast Network. If you'd like to learn more about Dr. Hill's work, look for her book, Pinnacles. If you have a story you'd like to share, send me an email to jake@milnermediapartners.com and finish this sentence for me. This one time in Kankakee. Listen to all of today's local news in one place.
Checking your WVLI News, I'm Rob West.
The WVLI News Update brings you the day's news in 10 minutes or less. Clear, credible, and on your schedule. Follow now wherever you get your podcasts or at WVLI927.com and click on air. It's all part of the new WVLI Podcast Network. The voices you trust beyond the dial.